Phlebotomy mock test with answers. Question 1. Which of the following scenarios is considered a breach of the Health Insurance Portability and Accountability Act, HIPAA? Option A. Discussing a patient's laboratory results with the ordering physician. Option B. Discussing a patient's lab results with a colleague in the hospital cafeteria. Option C. Entering patient information into an encrypted laboratory information system. Option D. Sharing critical panic values with the nurse assigned to the patient. The correct answer is option B. Discussing a patient's lab results with a colleague in the hospital cafeteria. Discussing patient results in a public cafeteria exposes protected health information to unauthorized listeners. HIPAA permits sharing information for treatment with authorized team members, but only in appropriate settings. Casual conversations in public areas violate confidentiality even when the colleague works in healthcare. Question 2. A phlebotomist must collect a cold agglutinin sample. How must this specimen be transported to the lab? Option A. Chilled on a slurry of ice and water. Option B. Maintained at body temperature, 37 degrees Celsius. Option C. Protected entirely from light exposure. Option D. Frozen immediately in dry ice. The correct answer is option B. Maintained at body temperature, 37 degrees Celsius. Cold agglutinin specimens must be kept warm because the antibodies can react at lower temperatures and alter the sample. Maintaining body temperature helps preserve the specimen condition needed for accurate testing. Chilling or freezing would encourage the very reaction the test handling is designed to avoid. Question 3. What type of vessel links the arterial system directly to the capillary network paths? Option A. Arteriole. Option B. Venule. Option C. Vena cava. Option D. Deep vein. The correct answer is option A. Arteriole. Arterioles connect arteries to capillary beds and regulate blood flow into tissues. Their muscular walls can constrict or dilate to control local perfusion. Venules drain capillaries, and lymph ducts carry lymph rather than arterial blood. Question 4. What is the primary clinical reason for avoiding the basilic vein whenever possible? Option A. It is too small to yield an adequate sample. Option B. It is located near the brachial artery and median nerve. Option C. It has a high tendency to collapse under low pressure. Option D. It contains valves that prevent blood flow into the tube. The correct answer is option B. It is located near the brachial artery and median nerve. The basilic vein lies close to the brachial artery and median nerve on the medial side of the arm. Accidental injury in this area can cause severe bleeding, nerve pain, or other complications. It is used only when safer veins are unavailable and the practitioner is confident in the site. Question 5. Which of the following tests must be kept warm at body temperature during transport to the laboratory? Option A. Cryoglobulins. Option B. Ammonia. Option C. Lactic acid. Option D. Free fatty acids. The correct answer is option A. Cryoglobulins. Cryoglobulin specimens must be maintained at body temperature until processing because the proteins can precipitate when cooled. Warming prevents premature precipitation that can alter test results. Ice transport is used for analytes such as ammonia or lactic acid, not cryoglobulins. Question 6. Which additive acts as a glycolytic inhibitor in a gray top tube? Option A. Sodium fluoride. Option B. Lithium heparin. Option C. DDTA. Option D. Thrombin. The correct answer is option A. Sodium fluoride. Sodium fluoride inhibits glycolysis, slowing the breakdown of glucose by blood cells after collection. It is commonly paired with an anticoagulant in gray tubes for glucose-related testing. Heparin, EDTA, and thrombin serve different purposes and do not primarily preserve glucose. Question 7. Which of the following elements can cause a falsely elevated calcium level during a venipuncture? Option A. Prolonged tourniquet application past 2 minutes. Option B. Chilling the specimen on an ice slurry. Option C. Using a 21-gauge needle on a large vein. Option D. Failing to wipe away the first drop of blood during a finger stick. The correct answer is option A. Prolonged tourniquet application past 2 minutes. Prolonged tourniquet application can concentrate proteins and protein-bound analytes, including calcium. This may create falsely elevated calcium results. Chilling, normal needle size, or capillary first drop handling do not cause the same venous stasis effect. Question 8. Which of the following legal terms is defined as the unauthorized, harmful, or offensive touching of another individual? Option A, assault. Option B, battery. Option C, defamation. Option D, malpractice. The correct answer is option B, battery. Battery is unauthorized, harmful, or offensive physical contact with another person. In phlebotomy, drawing blood without valid permission can constitute battery. Assault involves threat or fear of contact rather than the contact itself. Question 9. Which of the following tubes should be collected last in the standard venipuncture order of draw? Option A, light blue top. Option B, lavender top. Option C, gray top. Option D, green top. The correct answer is option C, gray top. Gray tubes are drawn near the end of the standard venipuncture order because fluoride and oxalate additives can interfere with other tests. Earlier tubes such as cultures, citrate, serum, heparin, and EDTA have higher priority in the sequence. Drawing gray tubes too early increases additive carryover risk. Question 10. What does the term basal state refer to in clinical laboratory testing? Option A, the condition of the body early in the morning, resting and fasting for roughly 12 hours. Option B, the physical state of the body directly following a heavy workout session. Option C, the point of highest metabolic activity in the afternoon. Option D, the body state while under heavy psychological stress. The correct answer is option A, the condition of the body early in the morning, resting and fasting for roughly 12 hours. Basal state refers to the body's resting condition after fasting, usually early in the morning. This state reduces the effects of recent meals, exercise, stress, and daily variation on laboratory values. Heavy activity or psychological stress can significantly alter some analytes. Question 11. Which of the following tubes contains an additive that preserves glucose levels for up to 3 days? Option A, gray top, sodium fluoride. Option B, light blue top. Option C, lavender top. Option D, green top. The correct answer is option A, gray top, sodium fluoride. Gray tubes containing sodium fluoride preserve glucose by inhibiting glycolysis for an extended period. This helps maintain glucose concentration when processing may be delayed. Other tube types do not provide the same glucose stabilizing additive. Question 12. Which of the following parameters is most heavily altered if a potassium sample is hemolyzed? Option A, the potassium level will be falsely elevated. Option B, the potassium level will be falsely decreased. Option C, the sodium level will rise to compensate. Option D, the hematocrit level will drop below readable thresholds. The correct answer is option A, the potassium level will be falsely elevated. Hemolysis releases intracellular potassium from red blood cells into the serum or plasma. This produces a falsely elevated potassium result that can appear clinically dangerous. Sodium and hematocrit are not affected in the same direct way by red cell rupture in a chemistry sample. Question 13. What color top tube contains the additive thrombin, which acts as a rapid clot activator for stat serum determinations? Option A, orange top. Option B, light blue top. Option C, lavender top. Option D, gray top. The correct answer is option A, orange top. Orange top tubes contain thrombin, a rapid clot activator used for some stat serum determinations. Thrombin speeds clot formation so serum can be processed quickly. Anticoagulant tubes such as lavender, gray, and light blue are intended to prevent clotting rather than accelerate it. Question 14. What type of hazard is represented by the yellow quadrant of the NFPA 704 diamond? Option A, health hazard. Option B, flammability hazard. Option C, instability or reactivity hazard. Option D, specific or special hazard. The correct answer is option C, instability or reactivity hazard. The yellow quadrant of the NFPA 704 diamond represents instability or reactivity. It warns how readily a material may react, decompose, or explode under certain conditions. Health, flammability, and special hazards are shown in the other quadrants. Question 15. Which of the following statements is true regarding a multisample needle gauge? Option A 21 gauge needle has a larger opening than a 22 gauge needle. Option B. An 18 gauge needle is smaller than a 23 gauge needle. Option C. The larger the gauge number, the larger the needle lumen. Option D. All needles used in phlebotomy have the same internal diameter. The correct answer is option A. A 21 gauge needle has a larger opening than a 22 gauge needle. Needle gauge numbers work inversely: the higher the number, the smaller the lumen. A 21 gauge needle therefore has a larger opening than a 22 gauge needle. Assuming all phlebotomy needles are the same size can lead to poor device selection and hemolysis risk. Question 16. What should a phlebotomist do if they observe small, red spots appearing on a patient's skin after applying a tourniquet? Option A. Remove the tourniquet immediately, as this indicates petechiae and potential bleeding issues. Option B. Tighten the tourniquet further to stop the spots from spreading. Option C. Ignore the spots, as they are a normal reaction to isopropyl alcohol. Option D. Rub the skin surface firmly to see if the spots disappear. The correct answer is option A. Remove the tourniquet immediately, as this indicates petechiae and potential bleeding issues. Petechiae after tourniquet application suggest fragile capillaries or a bleeding tendency. The tourniquet should be removed and the site reassessed before proceeding. Continuing pressure can worsen capillary bleeding and bruising. Question 17. What is the clinical term for small, red, pinpoint spots that appear on a patient's skin when a tourniquet is applied? Option A. Hematoma. Option B. Hemolysis. Option C. Petechiae. Option D. Ichthyosis. The correct answer is option C. Petechiae. Petechiae are tiny red or purple pinpoint spots caused by small capillary hemorrhages. They may appear when a tourniquet is applied to a patient with fragile capillaries or platelet problems. A hematoma is a larger collection of blood, while ichthyosis refers to broader bruising. Question 18. Which of the following statements is true regarding standard precautions in healthcare settings? Option A. They apply only to patients with known, documented infectious diseases. Option B. They mandate that blood and all body fluids must be treated as potentially infectious regardless of the patient's perceived status. Option C. They require healthcare workers to wear a full gown and face shield for every routine venipuncture. Option D. They permit the recapping of used needles as long as you use two hands. The correct answer is option B. They mandate that blood and all body fluids must be treated as potentially infectious regardless of the patient's perceived status. Standard precautions require treating all blood and body fluids as potentially infectious. This approach protects healthcare workers and patients regardless of diagnosis or appearance. Selective precautions based on perceived risk misinfections that are unknown or asymptomatic. Question 19. What is the clinical term for a decrease in the total number of circulating red blood cells or a decrease in hemoglobin concentration? Option A. Polycythemia. Option B. Anemia. Option C. Leukemia. Option D. Leukopenia. The correct answer is option B. Anemia. Anemia means a decrease in circulating red blood cells, hemoglobin concentration, or oxygen carrying capacity. It can cause fatigue, pallor, shortness of breath, or dizziness depending on severity. Polycythemia is increased red cell mass, while leukopenia involves white cells. Question 20. What is the correct action if a phlebotomist accidentally sticks themselves with a used needle? Option A. Wash the site with soap and water and immediately report the incident to a supervisor. Option B. Squeeze the wound to expel blood and apply a tight bandage. Option C. Wait until the end of the shift to fill out an incident report. Option D. Ask the patient if they have any blood-borne infectious diseases. The correct answer is option A. Wash the site with soap and water and immediately report the incident to a supervisor. A needle stick exposure should be washed promptly with soap and water and reported immediately. Rapid reporting allows exposure evaluation, source testing when permitted, and timely post-exposure management. Squeezing the wound, delaying the report, or questioning the patient informally is not an adequate response. Question 21. What is the clinical term for an increase in the total number of circulating red blood cells? Option A, anemia. Option B, polycythemia. Option C, leukemia. Option D, thrombocytopenia. The correct answer is option B, polycythemia. Polycythemia means an increased total number of circulating red blood cells or increased red cell mass. It can thicken blood and increase thrombotic risk depending on cause. Anemia is decreased red cell or hemoglobin concentration. Question 22. Which of the following parameters is evaluated when performing a basic metabolic panel, BMP? Option A, hemoglobin and hematocrit levels. Option B, the electrolytes, blood urea nitrogen, creatinine, and glucose. Option C, coagulation factor levels and platelet function. Option D, bacterial growth over a 48-hour incubation period. The correct answer is option B, electrolytes, blood urea nitrogen, creatinine, and glucose. A basic metabolic panel evaluates electrolytes, glucose, blood urea nitrogen, creatinine, and related chemistry values. It is used to assess kidney function, acid-base status, and metabolic balance. Liver enzymes, cardiac markers, and hematology counts belong to other panels or departments. Question 23. Which of the following practices is critical to perform when collecting a specimen for a cold agglutinin test? Option A, keep the collection tube pre-warmed to 37 degrees Celsius before and during collection. Option B, chill the tube in an ice slurry immediately after drawing. Option C, protect the specimen from light by wrapping it in heavy foil. Option D, centrifuge the tube immediately within 2 minutes of collection. The correct answer is option A, keep the collection tube pre-warmed to 37 degrees Celsius before and during collection. Cold agglutinin specimens must be collected and kept warm at about 37 degrees Celsius. Cooling can cause antibody-mediated red cell agglutination before testing and distort results. Pre-warmed tubes and warm transport preserve the specimen condition needed by the laboratory. Question 24. Which of the following practices is an example of an engineering control to prevent blood-borne pathogen exposure? Option A, wearing a face shield when opening specimen tubes. Option B, utilizing a sharps container with a wide, drop-in opening and safety needle shields. Option C, washing hands with antimicrobial soap for 20 seconds. Option D, following a strict order of draw sequence. The correct answer is option B, utilizing a sharps container with a wide, drop-in opening and safety needle shields. Sharps containers with safe openings and safety needle shields are engineering controls because they isolate or remove the hazard by design. These devices reduce needle stick risk during and after collection. Gloves and training are important but do not physically engineer the hazard away. Question 25. Which of the following options defines the proper order of draw for a blood culture, a lavender tube, and a gold SST tube? Option A, blood culture, gold SST, lavender. Option B, gold SST, lavender, blood culture. Option C, lavender, blood culture, gold SST. Option D, blood culture, lavender, gold SST. The correct answer is option A, blood culture, gold SST, lavender. Blood cultures are collected first, followed by serum tubes such as gold SST, and lavender EDTA tubes later. This sequence protects culture sterility and reduces additive carryover. Drawing EDTA before serum can contaminate later specimens with anticoagulant. Question 26. What type of consent occurs when a patient is fully informed of the risks, benefits, and alternatives of a procedure and signs a document? Option A, informed consent. Option B, implied consent. Option C, verbal consent. Option D, statutory consent. The correct answer is option A, informed consent. Informed consent occurs when a patient understands the procedure, risks, benefits, and alternatives and documents agreement. It is more formal than routine implied cooperation. Verbal or implied consent may be enough for many routine draws, but signed informed consent is used when required by policy. Question 27. What type of vessel carries oxygenated blood away from the heart to the systemic tissues? Option A, artery. Option B, vein. Option C, capillary. Option D, venule. The correct answer is option A, artery. Systemic arteries carry oxygenated blood away from the heart to body tissues. They operate under higher pressure and have thicker walls than veins. The pulmonary artery is an exception because it carries deoxygenated blood to the lungs. Question 28. What does the term lipemia describe? Option A high concentration of broken red blood cells giving serum a red tint. Option B, a milky or cloudy appearance of serum or plasma caused by high lipid or fat content. Option C, a dark yellow or amber tint in serum caused by elevated bilirubin levels. Option D, a clear, watery fluid component lacking any cellular proteins. The correct answer is option B, a milky or cloudy appearance of serum or plasma caused by high lipid or fat content. Lipemia describes a cloudy or milky serum or plasma appearance caused by high lipid content. It commonly follows recent fatty meals or certain metabolic conditions. Hemolysis appears red or pink, while icterus appears yellow to amber. Question 29. What type of communication technique involves nodding, maintaining eye contact, and repeating back statements to ensure clear understanding? Option A, passive communication. Option B, aggressive communication. Option C, active listening. Option D, defensive communication. The correct answer is option C, active listening. Active listening uses eye contact, nodding, attentive posture, and restating information to confirm understanding. It helps patients feel heard and reduces miscommunication during care. Passive, aggressive, or defensive communication does not reliably verify understanding. Question 30. Which antiseptic is recommended for a patient undergoing a skin puncture for a blood culture if they are allergic to chlorhexidine? Option A, 70% ethyl alcohol. Option B, povidone iodine. Option C, hydrogen peroxide. Option D, benzalkonium chloride. The correct answer is option B, povidone iodine. Povidone iodine is an appropriate alternative when chlorhexidine cannot be used for blood culture skin preparation. It provides broad antimicrobial activity when applied and allowed to dry according to protocol. Hydrogen peroxide and benzalkonium chloride are not standard substitutes for this purpose. Question 31. What is the correct clinical action for selecting a puncture site on an arm that has an active intravenous line? Option A, draw from a site distal to below the line to minimize fluid contamination. Option B, draw directly above the line insertion site. Option C, adjust the flow rate to run faster during the draw. Option D, draw from the line without flushing it first. The correct answer is option A, draw from a site distal to below the line to minimize fluid contamination. The fluids can dilute or contaminate specimens collected near the infusion source. When collection from an forearm is unavoidable and allowed by policy, a site below the is selected with appropriate coordination. The opposite arm remains preferred because it avoids infusion-related interference. Question 32. Which of the following practices helps ensure compliance with standard precautions in phlebotomy? Option A, wearing gloves during all vascular access procedures and changing them between patients. Option B, reusing plastic tube holders as long as no blood is visible on the outside surface. Option C, washing disposable nitrile gloves with soap and water to extend their use. Option D, placing used lancets into regular trash cans if they look clean. The correct answer is option A, wearing gloves during all vascular access procedures and changing them between patients. Standard precautions require gloves for vascular access and glove changes between patients. This treats all blood and body fluids as potentially infectious regardless of known diagnosis. Reusing holders, washing disposable gloves, or discarding sharps in regular trash violates safe practice. Question 33. What should a phlebotomist do if they encounter a patient who does not speak the same language as the healthcare provider? Option A, use hand gestures to explain the invasive procedure and proceed with the draw. Option B, enlist the services of a certified medical interpreter to ensure proper communication and consent. Option C, ask the patient's roommate to translate the instructions for you. Option D, cancel the test order and document the patient as uncooperative. The correct answer is option B. Enlist the services of a certified medical interpreter to ensure proper communication and consent. Certified medical interpreters ensure that the patient receives accurate information and can provide meaningful consent. Family members or untrained staff may omit, alter, or misunderstand medical details. Clear communication is essential for safety, cooperation, and legal compliance. Question 34. What type of vessel contains valves to prevent the backflow of blood as it travels back toward the heart? Option A, artery. Option B, capillary. Option C, vein. Option D, arteriole. The correct answer is option C, vein. Veins contain valves that help prevent backflow as blood returns to the heart at low pressure. These valves support venous return, especially from the limbs. Arteries carry blood under higher pressure and usually do not need valves along their length. Question 35. Which of the following elements is a key component of quality control in a point-of-care testing? POCT program. Option A, documenting the daily temperature of the laboratory refrigerator. Option B, verifying that the patient's insurance information is updated. Option C, running electronic or liquid controls according to manufacturer and facility guidelines. Option D, cleaning the outpatient waiting room chairs with bleach solution. The correct answer is option C, running electronic or liquid controls according to manufacturer and facility guidelines. POCT quality control includes running electronic or liquid controls according to manufacturer instructions and facility policy. Controls verify that the device, reagents, and operator process are producing reliable results. Patient testing without required QC can lead to inaccurate bedside decisions. Question 36. Which of the following additives is found in a grey top tube and works by precipitating calcium to prevent clotting? Option A, potassium oxalate. Option B, sodium citrate. Option C, lithium heparin. Option D, DDTA. The correct answer is option A, potassium oxalate. Potassium oxalate prevents clotting by precipitating calcium, making calcium unavailable for the coagulation cascade. It is commonly paired with sodium fluoride in grey tubes. Citrate and EDTA bind calcium differently, while heparin works through antithrombin. Question 37. Which of the following tubes contains a clot activator paired with a gel barrier separator? Option A, gold top, SST. Option B, light green top, PSD. Option C, lavender top. Option D, light blue top. The correct answer is option A, gold top, SST. Gold SST tubes contain a clot activator and gel separator. The clot activator promotes serum formation, and the gel forms a barrier during centrifugation. PSD tubes contain heparin for plasma, while lavender and light blue tubes contain anticoagulants for other testing. Question 38. Which of the following conditions can cause a specimen's serum to appear bright red or pink after centrifugation? Option A, lightmia. Option B, icterus. Option C, hemolysis. Option D, hemoconcentration. The correct answer is option C, hemolysis. Hemolysis releases hemoglobin from red cells and gives serum or plasma a red to pink color after centrifugation. It can also falsely alter potassium, LDH, ASD, and other analytes. Lightmia appears milky, and icterus appears yellow to amber. Question 39. A serum separator tube, SST, contains an additive that assists in what process? Option A, preventing coagulation. Option B, accelerating coagulation. Option C, inhibiting glycolysis. Option D, preserving blood cultures. The correct answer is option B, accelerating coagulation. Serum separator tubes contain a clot activator that speeds the formation of a clot before centrifugation. After clotting, the gel barrier separates serum from blood cells during spinning. Anticoagulants prevent clotting, so they would not produce serum in the same way. Question 40. Which of the following parameters must be strictly managed when collecting a sweat chloride test? Option A, keeping the sample frozen using dry ice. Option B, preventing evaporation of the sweat sample during collection. Option C, protecting the collecting flask from ambient artificial lights. Option D, drawing a matching light blue tube within 5 minutes. The correct answer is option B, preventing evaporation of the sweat sample during collection. Sweat chloride specimens must be protected from evaporation because chloride concentration can change as water is lost. Proper sealing and timely handling preserve the true concentration. Freezing, light protection, or paired coagulation tubes are not the main handling concern. Question 41. Which of the following values represents a normal fasting blood glucose level for a healthy adult? Option A, 70 to 99 mg/dl. Option B, 140 to 180 mg/dl. Option C, 200 to 250 mg/dl. Option D, 300 to 350 mg/dl. The correct answer is option A, 70 to 99 mg/dl. A normal fasting glucose for a healthy adult is generally about 70 to 99 mg/dl. Values above that range may suggest impaired fasting glucose or diabetes depending on diagnostic criteria and repeat testing. The higher ranges listed would be abnormal and require clinical follow-up. Question 42. What is the main reason for avoiding blind probing or sweeping when attempting to locate a vein? Option A, it breaks the vacuum seal of the multisample tube. Option B, it can cause permanent damage to underlying nerves and blood vessels. Option C, it dulls the needle tip and makes skin entry painful. Option D, it causes the patient's blood pressure to spike excessively. The correct answer is option B. It can cause permanent damage to underlying nerves and blood vessels. Blind probing or sweeping moves the needle through tissue without knowing where the tip is. This can damage nerves, arteries, tendons, and surrounding soft tissue. If blood flow is not obtained with minor adjustment, the attempt should be stopped and reassessed. Question 43. What is the primary purpose of applying a tourniquet during a venipuncture procedure? Option A, to stop the arterial blood flow to the limb. Option B, to engorge the veins and make them more palpable. Option C, to anchor the vein and prevent it from rolling. Option D, to ensure the sterility of the puncture site. The correct answer is option B, to engorge the veins and make them more palpable. A tourniquet temporarily slows venous returns so veins become fuller, easier to see, and easier to palpate. It should not stop arterial flow or be tightened enough to injure the patient. Vein anchoring and skin antisepsis are separate steps with different purposes. Question 44. Which of the following tests requires a fasting specimen to ensure diagnostic accuracy? Option A, complete blood count, CBC. Option B, lipid panel and fasting blood sugar. Option C, blood culture series. Option D, prothrombin time, patient. The correct answer is option B, lipid panel and fasting blood sugar. Lipid panels and fasting blood sugar tests are strongly affected by recent food intake. Fasting helps standardize triglyceride and glucose measurements for diagnostic interpretation. CBC, blood cultures, and patient usually do not require fasting for accuracy. Question 45. What is the clinical term for a state of fainting or temporary loss of consciousness caused by a sudden drop in blood pressure? Option A, syncope. Option B, shock. Option C, vertigo. Option D, hemostasis. The correct answer is option A, syncope. Syncope is a temporary loss of consciousness caused by reduced blood flow to the brain, often from a sudden blood pressure drop. It may occur during venipuncture due to anxiety, pain, fasting, or vasovagal response. Shock and vertigo are different clinical conditions. Question 46. What occurs when a phlebotomist shakes a blood collection tube vigorously instead of inverting it gently? Option A, hemoconcentration of the plasma. Option B, hemolysis of the red blood cells. Option C, complete inhibition of clotting factors. Option D, falsely elevated platelet counts. The correct answer is option B, hemolysis of the red blood cells. Vigorous shaking mechanically damages red blood cells and can cause hemolysis. Additive tubes should be mixed by gentle inversions so the additive distributes without cell rupture. Shaking does not improve clotting control and can make the specimen unsuitable for testing. Question 47. What should a phlebotomist do if a patient experiences a sudden, sharp, shooting pain down their arm during a venipuncture? Option A. Advance the needle deeper to see if the pain stops. Option B. Terminate the venipuncture immediately, withdraw the needle, and assess for nerve injury. Option C. Tell the patient that minor discomfort is completely normal for this vein. Option D. Instruct the patient to keep their arm completely still while you finish filling the tube. The correct answer is option B. Terminate the venipuncture immediately, withdraw the needle, and assess for nerve injury. Sudden sharp shooting pain down the arm suggests possible nerve contact. The venipuncture should be terminated immediately, the needle withdrawn, and the patient assessed according to policy. Continuing or redirecting the needle can worsen nerve injury. Question 48. What color top tube is used to collect specimens for blood bank immunohematology testing like antibody screens? Option A. Pink top or glass red top. Option B. Gray top. Option C. Light blue top. Option D. Light green top. The correct answer is option A. Pink top or glass red top. Pink EDTA tubes or glass red tubes are commonly used for blood bank immunohematology testing such as antibody screens. These specimens support red cell typing and compatibility testing. Gray, light blue, and light green tubes serve glucose, coagulation, and chemistry testing needs. Question 49. A phlebotomist enters a room to draw blood from an inpatient but notices the patient does not have an identification band attached to their body. What is the proper course of action? Option A. Draw the blood anyway and ask the patient to state their name. Option B. Look for the ID band on the nightstand or 4-pole and scan it. Option C. Refuse to draw the blood until a nurse attaches a new ID band to the patient. Option D. Verify identity using the chart at the foot of the bed and complete the draw. The correct answer is option C. Refuse to draw the blood until a nurse attaches a new ID band to the patient. An inpatient must have an identification band attached to the body before routine collection. A band on a table, bed rail, or 4-pole cannot prove the patient's identity. Nursing staff should replace or verify the band before the phlebotomist proceeds. Question 50. What is the function of platelets, thrombocytes, in the human body? Option A. Transporting carbon dioxide back to the pulmonary system. Option B. Producing specific antibody proteins to neutralize viral particles. Option C. Participating in primary hemostasis by aggregating to form a platelet plug. Option D. Maintaining systemic core body temperature variations. The correct answer is option C. Participating in primary hemostasis by aggregating to form a platelet plug. Platelets support primary hemostasis by adhering to damaged vessel surfaces and aggregating into a platelet plug. They also provide a surface for coagulation reactions that stabilize clot formation. Red cells carry gases, and leukocytes provide immune defense. Question 51. Which of the following factors is a major cause of specimen rejection in the laboratory? Option A. Collecting a lavender top tube for a CBC test. Option B. Submitting an underfilled light blue coagulation tube. Option C. Delivering a chemistry specimen to the lab within 4 to 5 minutes. Option D. Affixing a handwritten label over a pre-printed barcode label. The correct answer is option B. Submitting an underfilled light blue coagulation tube. Underfilled light blue coagulation tubes are a common cause of specimen rejection because the blood-to-citrate ratio is invalid. Excess citrate can alter clotting times and make results unreliable. Proper tube fill is more critical for citrate tubes than for many serum or EDTA tubes. Question 52. How many times should a light blue top tube be inverted immediately after collection? Option F. 1 to 2 times. Option B. 3 to 4 times. Option C. 5 to 8 times. Option D. 10 to 12 times. The correct answer is option B. 3 to 4 times. Light blue citrate tubes should be gently inverted 3 to 4 times after filling. This distributes the anticoagulant without damaging cells or activating clotting. Too few inversions can allow clot formation, while vigorous shaking can cause hemolysis. Question 53. Which of the following elements is critical to include on a manual handwritten specimen tube label? Option A, phlebotomist's initials, patient's full name, DOB, date, and time of collection. Option B, patient's insurance policy number and diagnosis code. Option C, phlebotomist's full signature and room number. Option D, name of the ordering physician and laboratory phone number. The correct answer is option A, phlebotomist's initials, patient's full name, DOB, date, and time of collection. A manual tube label must clearly identify the patient, the collector, and the collection timing. Full name, date of birth or other unique identifier, date, time, and phlebotomist initials support traceability. Insurance data, diagnosis codes, and physician phone numbers do not replace specimen identifiers. Question 54. Which of the following additives is used in a blood culture bottle to neutralize antibiotics circulating in the patient's blood? Option A, resin or activated charcoal particles. Option B, sodium polyant whole sulfonate, SPS. Option C, acid citrate dextrose, ACD. Option D, thixotropic gel barrier. The correct answer is option A, resin or activated charcoal particles. Resin or activated charcoal in blood culture bottles combined or neutralize antibiotics present in the patient's blood. This improves recovery of organisms when the patient has already received antimicrobial therapy. The additive does not replace sterile collection technique or proper bottle filling. Question 55. If a phlebotomist must collect blood from a patient with an active, running foreline in both arms, what is the preferred option? Option A, draw the blood from a capillary puncture if the tests allow. Option B, turn off the for yourself and draw above the line immediately. Option C, draw from the foot or ankle without a physician's order. Option D, postpone the draw indefinitely until the patient is discharged. The correct answer is option A, draw the blood from a capillary puncture if the tests allow. When both arms have running forelines, venous sampling near either infusion may be diluted or contaminated. If the ordered tests permit capillary collection, skin puncture can avoid the active infusion sites. Turning off force or using lower extremity veins requires nursing or provider direction and facility policy. Question 56. What type of fire hazard is represented by the red quadrant of the NFPA 704 diamond? Option A, flammability hazard. Option B, health hazard. Option C, reactivity hazard. Option D, specific hazard. The correct answer is option A, flammability hazard. The red quadrant of the NFPA 704 diamond indicates flammability hazard. It communicates how readily a material can ignite. Blue represents health, yellow represents instability, and white indicates special hazard information. Question 57. What represents the correct order for removing personal protective equipment, PPE, after a procedure? Option A, gown, gloves, mask, goggles. Option B, gloves, goggles, gown, mask. Option C, mask, gown, goggles, gloves. Option D, goggles, mask, gloves, gown. The correct answer is option B, gloves, goggles, gown, mask. PPE is removed in a sequence that limits contamination of clean skin and clothing. Gloves are usually removed first because they are most contaminated, followed by eye protection, gown, and mask according to facility procedure. Removing the mask too early or touching the outside of contaminated PPE increases exposure risk. Question 58. What should a phlebotomist do if a patient states they have a history of severe syncope during blood draws? Option A, perform the venipuncture while the patient is standing up to keep them alert. Option B, place the patient in a recumbent, supine, position on a bed or reclining chair before starting the draw. Option C, tell the patient to close their eyes and hold their breath during the puncture. Option D, request a doctor to administer general anesthesia before the draw. The correct answer is option B, place the patient in a recumbent, supine, position on a bed or reclining chair before starting the draw. A patient with a history of severe syncope should be positioned supine or reclined before collection. This reduces fall risk and supports circulation if fainting occurs. Standing or breath holding increases danger and should be avoided. Question 59. Which of the following situations can cause a false elevation in a patient's serum ammonia level? Option A. Transporting the specimen to the laboratory on ice. Option B. Delaying the separation of cells from the plasma beyond 15 minutes at room temperature. Option C. Using a green top tube containing sodium heparin. Option D. Labeling the specimen tube at the patient's bedside. The correct answer is option B. Delaying the separation of cells from the plasma beyond 15 minutes at room temperature. Ammonia can rise falsely when cells remain in contact with plasma at room temperature. Prompt chilling, rapid transport, and timely separation help preserve the true value. Delays beyond recommended handling times are a major pre-analytical source of error. Question 60. What is the standard ratio of blood to anticoagulant additive in a green top tube? Option A 9:1. Option B 4:1. Option C. There is no strict ratio as long as the tube contains enough anticoagulant to prevent clotting. Option D 1:1. The correct answer is option C. There is no strict ratio as long as the tube contains enough anticoagulant to prevent clotting. Green top heparin tubes do not depend on a strict blood-to-additive ratio like light blue citrate tubes. The tube should still be filled adequately and mixed gently so enough heparin is present to prevent clotting. Coagulation citrate specimens are the classic ratio-sensitive collection. Question 61. When instructing a patient on how to collect a clean catch midstream urine sample, what is a key step? Option A. Avoiding directly into the cup without any prior cleaning steps. Option B. Cleansing the genital area with an antiseptic wipe, voiding a small amount into the toilet, and then catching the middle portion of the stream in the cup. Option C. Saving all urine voided over a continuous 24-hour window in a refrigerated jug. Option D. Restricting fluid intake for 48 hours prior to voiding the sample. The correct answer is option B. Cleansing the genital area with an antiseptic wipe, voiding a small amount into the toilet, and then catching the middle portion of the stream in the cup. Clean catch midstream collection reduces contamination from skin and genital flora. The patient cleanses first, begins voiding into the toilet, and then collects the middle portion of the urine stream. Collecting the first urine directly into the cup increases contamination risk. Question 62. What should a phlebotomist do if they encounter an unconscious patient in an emergency room with no identification band? Option A. Refuse to draw the blood until the patient wakes up and identifies themselves. Option B. To assign a temporary unique numeric identifier to the patient according to facility protocol and label tubes accordingly. Option C. Use the name written on the patient's personal clothing or belongings. Option D. Label the tubes with John Doe and leave the medical record number blank. The correct answer is option B. Assign a temporary unique numeric identifier to the patient according to facility protocol and label tubes accordingly. An unidentified emergency patient may receive a temporary unique identifier under facility protocol. Specimens are labeled with that identifier so testing can proceed while maintaining traceability. Clothing, belongings, or generic names are unsafe sources of identity. Question 63. What is the liquid portion of an anticoagulated, centrifuged blood specimen called? Option A. Serum. Option B. Plasma. Option C. Whole blood. Option D. Fibrin clot. The correct answer is option B. Plasma. Plasma is the liquid portion of anticoagulated blood after centrifugation. It contains clotting factors because clot formation has been prevented. Serum comes from clotted blood and lacks fibrinogen and many clotting factors. Question 64. What is the proper location for a capillary puncture on an infant's foot? Option A. The center of the plantar surface near the arch. Option B. The medial or lateral borders of the plantar surface of the heel. Option C. The tip of the great toe. Option D. The posterior curvature of the heel bone. The correct answer is option B. The medial or lateral borders of the plantar surface of the heel. Infant heel punctures are performed on the medial or lateral borders of the plantar heel. These areas avoid the calcaneus and reduce the chance of bone injury. The arch, great toe, and posterior heel are unsafe sites for routine infant skin puncture. Question 65. Which of the following parameters can cause a false decrease in glycolysis tracking within a serum specimen? Option A. Leaving the serum in contact with the red blood cells for longer than 2 hours. Option B. Chilling the specimen on ice immediately after collection. Option C. Protecting the specimen from exposure to room lights. Option D. Mixing the tube gently 5 times right after the draw. The correct answer is option A. Leaving the serum in contact with the red blood cells for longer than 2 hours. Glucose decreases when unseparated blood remains at room temperature because cells continue glycolysis. Serum left in contact with red cells for more than 2 hours can therefore show falsely low glucose. Prompt separation or use of a glycolysis inhibitor helps preserve the result. Question 66. What clinical condition is characterized by fluid accumulation in the intercellular tissue spaces, making the arm swollen? Option A. Lymphedema or edema. Option B. petechiae. Option C. Sclerosis. Option D. hematoma. The correct answer is option A. Lymphedema or edema. Lymphedema or edema describes swelling from fluid accumulation in intercellular tissue spaces. It may occur after lymph node removal, obstruction, injury, or other circulation problems. Drawing from a swollen limb can be difficult and may produce unreliable specimens. Question 67. Which of the following items must be included on a computer-generated barcode specimen label? Option A. The patient's diagnosis and name of their insurance carrier. Option B. Unique patient identifiers, date, time of collection, and phlebotomist ID code. Option C. The phone number of the patient's next of kin. Option D. The laboratory technician's home address. The correct answer is option B. Unique patient identifiers, date, time of collection, and phlebotomist ID code. A barcode specimen label must include unique patient identifiers, collection date and time, and collector identification. These elements support traceability from bedside collection through laboratory reporting. Insurance information and unrelated personal data do not belong on the tube label. Question 68. What type of sample is collected during a therapeutic phlebotomy procedure? Option A. A tiny capillary tube for microhematocrit checking. Option B. A large unit of blood, typically 450 to 500 ml, to treat conditions like polycythemia vera. Option C. A series of 3 blood culture bottles over 24 hours. Option D. An arterial sample for gas analysis. The correct answer is option B. A large unit of blood, typically 450 to 500 ml, to treat conditions like polycythemia vera. Therapeutic phlebotomy removes a large volume of blood, often about 450 to 500 ml, to reduce red cell mass or iron burden. It may be used for conditions such as polycythemia vera or hemochromatosis under provider order. It is different from diagnostic venipuncture, which collects small specimen volumes. Question 69. What is the correct order of draw when collecting a blood culture, a chemistry SSD, and a sodium citrate tube using a multisample needle system? Option A. BSST, light blue, blood culture. Option B. Blood culture, light blue, SST. Option C. Light blue, SST, blood culture. Option D. Blood culture, SST, light blue. The correct answer is option B. Blood culture, light blue, SST. Blood cultures are drawn first, followed by light blue citrate tubes and then serum tubes such as SST. This sequence protects culture sterility and reduces additive carryover into coagulation specimens. Drawing SST before citrate can introduce clot activator or gel-related contamination risk. Question 70. What is the function of the thixotropic gel inside an SST or PSD tube? Option A. To accelerate the coagulation cascade. Option B. To form a physical barrier between cells and serum/plasma during centrifugation. Option C. To preserve glucose levels for up to 24 hours. Option D. To chelate calcium and prevent fibrin formation. The correct answer is option B. To form a physical barrier between cells and serum/plasma during centrifugation. Thixotropic gel moves during centrifugation to create a stable barrier between the cells and the serum or plasma. This separation limits ongoing cellular metabolism and analyte exchange after spinning. The gel does not act as the anticoagulant or the clot activator. Question 71. What is the clinical name for the stoppage of bleeding from a damaged blood vessel? Option A, hemostasis. Option B, homeostasis. Option C, hemolysis. Option D, hemoconcentration. The correct answer is option A, hemostasis. Hemostasis is the process that stops bleeding after vessel injury. It involves vascular constriction, platelet plug formation, and coagulation. Homeostasis is broader internal balance, while hemolysis and hemoconcentration are specimen or blood changes. Question 72. What is the primary purpose of the multisample needle's rubber sleeve? Option A, to cushion the patient's vein from sudden movements. Option B, to prevent blood from leaking into the tube holder adapter between tube changes. Option C, to keep the needle sharp until it enters the vein. Option D, to guide the needle into the exact center of the vacuum tube. The correct answer is option B, to prevent blood from leaking into the tube holder adapter between tube changes. The rubber sleeve on a multisample needle seals the back end of the needle between tube changes. This prevents blood from leaking into the holder and reduces exposure risk. It does not guide the needle into the vein or protect the vein from movement. Question 73. Which of the following infections is considered the most common nosocomial risk for healthcare workers handling blood? Option A, human immunodeficiency virus, HIV. Option B, hepatitis B virus, HBV. Option C, tuberculosis, TB. Option D, malaria. The correct answer is option B, hepatitis B virus, HBV. Hepatitis B has historically been a major occupational concern for workers exposed to blood because it is efficiently transmitted by percutaneous injury. Vaccination reduces risk, but exposure prevention remains essential. HIV, tuberculosis, and malaria require appropriate precautions, yet they are not the most common blood-handling nosocomial risk in this context. Question 74. What type of protective equipment must be worn when performing a venipuncture on a patient with droplet precautions? Option A, an N95 respirator mask and shoe covers. Option B, a standard surgical mask and gloves. Option C, a full-body Tyvek suit and goggles. Option D, no personal protective equipment is required. The correct answer is option B, a standard surgical mask and gloves. Droplet precautions require a surgical mask, and gloves are used for venipuncture under standard precautions. The mask protects mucous membranes from large respiratory droplets during close contact. N95 respirators are reserved for airborne precautions. Question 75. Which of the following tubes contains an additive that prevents clotting by activating antithrombins? Option A, light blue top, sodium citrate. Option B, green top, heparin. Option C, lavender top, EDTA. Option D, gray top, potassium oxalate. The correct answer is option B, green top, heparin. Heparin prevents clotting by activating antithrombin, which inhibits thrombin and other clotting factors. Green top tubes use this mechanism for plasma chemistry and selected special tests. EDTA and citrate work by binding calcium rather than activating antithrombin. Question 76. What clinical complication can arise if a phlebotomist punctures the skin through wet alcohol? Option A, the needle will slip and miss the vein entirely. Option B, the red blood cells in the sample may hemolyze, ruining the specimen integrity. Option C, the patient's blood pressure will drop rapidly. Option D, the vacuum inside the collection tube will increase significantly. The correct answer is option B, the red blood cells in the sample may hemolyze, ruining the specimen integrity. Puncturing through wet alcohol can introduce alcohol into the specimen and irritate the site. It may contribute to hemolysis and can cause a stinging sensation for the patient. The antiseptic must air dry completely before needle insertion. Question 77. Which of the following procedures requires a strict chain of custody documentation form to accompany the sample? Option A. Routine cholesterol screen. Option B. Workplace drug testing. Option C. Blood culture for endocarditis. Option D. Complete blood count for anemia. The correct answer is option B. Workplace drug testing. Workplace drug testing requires chain of custody documentation because results may have legal or employment consequences. The form tracks the specimen from collection through analysis and reporting. Routine cholesterol, CBC, or culture specimens do not usually require forensic level tracking. Question 78. If a phlebotomist notes that a patient has an active hematoma in the right antecubital area, where should they draw blood? Option A. Distal to, below, the hematoma in the right arm, or use the left arm. Option B. Directly through the center of the active hematoma swelling. Option C. Proximal to, above, the hematoma on the upper right arm. Option D. From the foot on the same side as the hematoma. The correct answer is option A. Distal to, below, the hematoma in the right arm, or use the left arm. An active hematoma contains pooled blood outside the vessel and should not be punctured. The opposite arm is preferred, or a site distal to the hematoma may be used if appropriate and permitted. Drawing through the swelling can contaminate the sample and worsen bruising. Question 79. What type of consent is assumed when an emergency department patient is unconscious and requires immediate life-saving laboratory work? Option A. Expressed consent. Option B. Informed consent. Option C. Implied consent. Option D. Verbal consent. The correct answer is option C. Implied consent. Emergency implied consent applies when an unconscious patient needs immediate life-saving care and cannot provide permission. Necessary laboratory work may proceed under facility policy to support urgent treatment. This differs from routine outpatient cooperation or signed informed consent. Question 80. What should a phlebotomist do if they accidentally touch the site after it has been cleansed with alcohol? Option A. Proceed with the venipuncture immediately before the site gets contaminated further. Option B. Blow on the skin surface to dry any skin oils that transferred. Option C. Re-cleanse the site completely with a fresh alcohol prep pad and allow it to dry. Option D. Wipe the needle tip with alcohol before inserting it into the skin. The correct answer is option C. Re-cleanse the site completely with a fresh alcohol prep pad and allow it to dry. Touching a cleaned puncture site recontaminates the skin and compromises antisepsis. The site should be cleansed again with a fresh prep pad and allowed to air dry. Wiping the needle or blowing on the skin does not restore a clean field. Question 81. When performing a newborn screening, PKU, collection card, how must the blood be applied to the filter paper? Option A. Layered drop upon drop until the circle is saturated. Option B. Applied to both sides of the paper simultaneously. Option C. Brought into direct contact with a single large drop to fill the circle completely. Option D. Smeared across the surface using a plastic capillary tube. The correct answer is option C. Brought into direct contact with a single large drop to fill the circle completely. Newborn screening filter paper should be filled by touching the paper to a large hanging drop of blood until the circle saturates. The blood should soak through evenly from one side without layering multiple drops. Smearing, scraping, or applying blood to both sides can invalidate the specimen. Question 82. What color top tube contains the additive sodium citrate and is used for coagulation profiles? Option A. Light blue top. Option B. Lavender top. Option C. Green top. Option D. Gray top. The correct answer is option A. Light blue top. Light blue tubes contain sodium citrate and are used for coagulation profiles. Citrate binds calcium reversibly and preserves clotting factors for testing when the tube is properly filled. Other tube colors contain additives that can interfere with coagulation assays. Question 83. What type of collection is performed to screen for hidden blood in a stool specimen? Option A. Occult blood test, GWAC. Option B. Culture and sensitivity, C&S. Option C. Dova and parasites, O&P. Option D. Fecal fat quantification. The correct answer is option A. Occult blood test, GWARC. An occult blood test, often using a GWARC method, screens stool for hidden blood. It can help detect gastrointestinal bleeding that is not visible. Culture, over and parasite testing, and fecal fat analysis evaluate different stool conditions. Question 84. Which of the following tests is used to monitor a patient's heparin therapy? Option A, prothrombin time, patient. Option B, activated partial thromboplastin time, APTT. Option C, hemoglobin A1c. Option D, rheumatoid factor, RF. The correct answer is option B, activated partial thromboplastin time, APTT. APTT evaluates the intrinsic pathway and is commonly used to monitor unfractionated heparin therapy. Heparin affects clotting factors measured by this pathway. Patient is more associated with warfarin monitoring, while HbA1c and rheumatoid factor are unrelated to heparin dosing. Question 85. What does a trough level measure in therapeutic drug monitoring, TDM? Option A, the highest concentration of the drug in the patient's system. Option B, the lowest concentration of the drug, measured right before the next dose. Option C, the average concentration of the drug over a 24-hour window. Option D, the amount of drug excreted through the kidneys. The correct answer is option B, the lowest concentration of the drug, measured right before the next dose. A trough level measures the lowest drug concentration, usually just before the next scheduled dose. Timing is critical because the result guides dosing safety and therapeutic effectiveness. Peak levels measure the highest concentration after dosing and answer a different clinical question. Question 86. Which of the following parameters must be strictly managed when collecting an arterial blood gas, ABG, sample? Option A, protecting the syringe from exposure to direct light sources. Option B, ensuring the sample is analyzed within a strict time frame and transported according to facility requirements. Option C, inverting the syringe 20 times to mix the clot activator. Option D, using a gray top tube to transport the arterial blood. The correct answer is option B, ensuring the sample is analyzed within a strict time frame and transported according to facility requirements. ABG specimens are time-sensitive because blood gases and pH can change after collection. The sample must be transported and analyzed promptly according to facility requirements. Delays, air bubbles, or improper temperature handling can distort oxygen, carbon dioxide, and pH values. Question 87. What is the primary function of the circulatory system's capillaries? Option A, transporting blood under high pressure away from the ventricles. Option B, permitting the exchange of nutrients, gases, and waste products between blood and tissue cells. Option C, directing large units of blood directly into the vena cava pathways. Option D, preventing the backflow of lymph fluid into the deep tissues. The correct answer is option B, permitting the exchange of nutrients, gases, and waste products between blood and tissue cells. Capillaries are the exchange vessels of the circulatory system. Their thin walls permit transfer of oxygen, carbon dioxide, nutrients, and waste products between blood and tissues. Arteries and veins mainly transport blood to and from capillary beds. Question 88. What is the correct angle of insertion for a standard multisample needle during a venipuncture? Option A, 5 to 10 degrees. Option B, 15 to 30 degrees. Option C, 45 to 60 degrees. Option D, 90 degrees. The correct answer is option B, 15 to 30 degrees. A standard straight needle is usually inserted at a shallow 15 to 30 degree angle to enter the vein smoothly. This angle helps avoid passing through the vein or striking deeper structures. Very shallow angles can miss the lumen, while steep angles increase tissue trauma. Question 89. A patient refuses to have their blood drawn. What is the most appropriate next step for the phlebotomist? Option A, convince the patient by explaining the doctor's orders. Option B, proceed with the draw while the nurse holds the patient's arm. Option C, document the refusal and immediately notify the nursing staff or provider. Option D, leave the room and mark the collection as completed. The correct answer is option C, document the refusal and immediately notify the nursing staff or provider. A competent patient has the right to refuse venipuncture, even when a provider ordered the test. The phlebotomist should document the refusal and notify nursing staff or the ordering provider so follow-up decisions can be made. Attempting to persuade aggressively or drawing against the patient's wishes can create legal and ethical problems. Question 90. Which of the following tests requires that the sample be protected from light by wrapping the tube in aluminum foil? Option A, vitamin B12 and carotene. Option B, blood urea nitrogen, BUN. Option C, partial thromboplastin time, PTT. Option D, complete blood count, CBC. The correct answer is option A, vitamin B12 and carotene. Vitamin B12 and carotene are light sensitive and may require protection with foil or an amber container. Light exposure can degrade sensitive analytes and produce inaccurate results. BUN, PTT, and CBC do not have the same routine light protection requirement. Question 91. Which of the following veins is located on the outer thumb side of the arm and is the third choice for venipuncture? Option A, cephalic vein. Option B, basilic vein. Option C, median cubital vein. Option D, brachial vein. The correct answer is option A, cephalic vein. The cephalic vein lies on the lateral, thumb side of the arm and is often a later choice for venipuncture. It may be more difficult to anchor and access than the median cubital vein. The basilic vein is medial and carries greater nerve and artery risk. Question 92. What type of hazard does the blue quadrant of the NFPA 704 diamond represent? Option A, flammability hazard. Option B, reactivity hazard. Option C, health hazard. Option D, special or specific hazard. The correct answer is option C, health hazard. The blue quadrant of the NFPA 704 diamond represents health hazard severity. It communicates the potential for harm from exposure to the material. Red indicates flammability, yellow indicates instability, and white is used for special hazards. Question 93. What is the correct order of draw for a multitube venipuncture sequence involving a coagulation tube, a blood culture, and a hematology tube? Option A, light blue, blood culture, lavender. Option B, blood culture, light blue, lavender. Option C, lavender, light blue, blood culture. Option D, blood culture, lavender, light blue. The correct answer is option B, blood culture, light blue, lavender. Blood cultures are collected first to maintain sterility, followed by light blue coagulation tubes and then lavender hematology tubes. This order reduces contamination and additive carryover. Drawing EDTA before citrate can interfere with coagulation results. Question 94. Which of the following tests evaluated the intrinsic pathway of the coagulation cascade and is used to monitor heparin therapy? Option A, prothrombin time, patient. Option B, activated partial thromboplastin time, APTT. Option C, bleeding time test. Option D, fibrin degradation products, FDP. The correct answer is option B, activated partial thromboplastin time, APTT. APTT evaluates the intrinsic and common coagulation pathways and is used to monitor unfractionated heparin therapy. Heparin prolongs clotting activity measured by this test. Patient and INR are more associated with warfarin and the extrinsic pathway. Question 95. What is the primary clinical reason for wiping away the first drop of blood during a capillary skin puncture? Option A, to eliminate surface bacterial contamination from the skin. Option B, to remove tissue fluid contamination that can dilute the sample and cause microclots. Option C, to prevent the blood from clotting too quickly in the microcollection tube. Option D, to ensure that the blood flow is adequate for collection. The correct answer is option B, to remove tissue fluid contamination that can dilute the sample and cause microclots. The first drop from a capillary puncture is wiped away because it can contain tissue fluid and activated clotting material. Removing it improves sample concentration and reduces microclot risk. Excessive squeezing after the puncture can reintroduce tissue fluid contamination. Question 96. What type of transmission occurs when an infectious agent is spread through contaminated food, water, or drugs? Option A, vehicle-borne transmission. Option B, vector-borne transmission. Option C, airborne transmission. Option D, direct contact transmission. The correct answer is option A, vehicle-borne transmission. Vehicle-borne transmission occurs through contaminated food, water, drugs, or other shared substances. The infectious agent is carried by a non-living medium to the host. Vector-borne transmission involves living carriers such as mosquitoes or ticks. Question 97. What is the primary function of erythrocytes, red blood cells, in the human body? Option A, defending the tissues against pathogenic bacterial invasions. Option B, participating in the primary aggregation phase of blood clotting. Option C, transporting oxygen from the lungs out to the body tissues and carbon dioxide back to the lungs. Option D, producing circulating antibody proteins in response to vaccinations. The correct answer is option C, transporting oxygen from the lungs out to the body tissues and carbon dioxide back to the lungs. Erythrocytes transport oxygen from the lungs to tissues and help return carbon dioxide to the lungs. Their hemoglobin content allows efficient gas binding and delivery. White cells defend against infection, and platelets support clot formation. Question 98. What should a phlebotomist do if they notice that the expiration date on a vacuum collection tube has passed? Option A, use the tube anyway if it is the only one available on the tray. Option B, discard the expired tube and select a current, unexpired tube from inventory. Option C, assume the additive inside is still functional for another 6 months. Option D, write the current date over the expiration date on the label. The correct answer is option B. Discard the expired tube and select a current, unexpired tube from inventory. Expired vacuum tubes may have reduced vacuum, degraded additives, or compromised sterility. They should be discarded and replaced with unexpired tubes from inventory. Using an expired tube can cause short draws, clotting, contamination, or inaccurate results. Question 99. Which of the following tubes contains the anticoagulant lithium heparin? Option A, light green top, PSD. Option B, dark blue top. Option C, yellow top. Option D, gray top. The correct answer is option A, light green top, PSD. Light green plasma separator tubes commonly contain lithium heparin and a gel barrier for chemistry testing. Heparin prevents clotting so plasma can be separated quickly after centrifugation. Other tube colors are used for trace metals, cultures, glucose preservation, or coagulation testing. Question 100. Which of the following items is classified as a biohazard and must be disposed of in a rigid sharps container? Option A clean, unused plastic tube holder. Option B, a blood-soaked gauze pad. Option C, a used lancet device from a heel stick. Option D, the paper backing from an adhesive bandage. The correct answer is option C, a used lancet device from a heel stick. A used lancet is a contaminated sharp and must be placed in a rigid sharps container. Sharps disposal prevents puncture injury and blood-borne pathogen exposure. Gauze may be biohazardous if saturated, but it does not belong in a sharps container unless it contains a sharp.